My name is Imani.
And my name is Shelby, and I'll be showing you hip and knee flexion range of motion tests. So I'll start with having my patient lay supine, and I'm gonna first have to find their greater trochanter so I know where to have my stationary arm pointed to. So I'll have them right here, and then do some internal, external rotation. Okay, you can relax back down. Our feet are gonna be nice and natural on the table. My fulcrum is going to be placed at their lateral femoral condyle, stationary arm facing that greater trochanter, movement arm going towards their lateral medialis. Starting at 80. There you go. We're going to be having a good start at 90 degrees. And I'll have them bring their foot as close as they can to their butt. And we're ending at 122. Okay, normal is around 150. So now we're doing hip flexion. So again, find the greater trochanter. Have some internal, external rotation. Okay, you can place it back down for now. I'll have my fulcrum placed at the greater trochanter, keeping my stationary arm going towards their torso. And we're gonna be starting around 90. So I'll have my patient pick up their leg, having the movement arm going towards that lateral condyle, and then they will be bringing their leg in as much as they can, keeping it in line. Oh my goodness, it keeps moving. Okay. We're ending at 109, which it is roughly around 130. So, yeah.
Now I'm going to be doing range of motion tests for hip internal rotation. So the first thing I'm going to do, I'm going to have my patient sit short-seated, and I'm going to line the fulcrum up with the patella. I'm going to keep the stationary arm perpendicular to the floor, and the movement arm is going to be in line with the midline of her tibia. Okay, I'm going to have my patient bring her foot outward away from her other foot so that the ball and socket joint in the hip internally rotates while her knee is externally rotating. You can relax. We started at 0 because we started at 180. She ends at 155, so she got a 35-degree range of motion, which is in normal range. Now I'm going to do range of motion for hip adduction. So I'm going to have my patient lay supine with the leg that we're measuring, which is going to be her left leg, is going to stay on the table, and she's going to hang her right leg off the table. I will stand on side of her leg to just give her some support so she doesn't fall off the table. First, I'm going to find her ASIS, which I already got consent for. Her bony prominence here in her pelvis. I'm going to line the fulcrum up with the ASIS that's staying on the table, and I'm going to line the stationary arm with, I'm going to make it parallel to her ASIS. The movement arm will be lined up with her tibial tuberosity. I'm going to follow it up just to make sure, and then I'm going to have her adduct, which is bring her leg in towards her midline. Do that for me. You can relax. She started at a perfect 90 degree. She ends at 105, which is about a 15-degree range of motion, which is in the normal range.
So now I'll be palpating the gluteus tubercle. So first I'll find where the patella is, go down to where I can find that tibial tuberosity. Slightly out medial and lateral, I'll find the medial and lateral tibial condyles. And then on that lateral side, I'll go just a little bit more till I find the next bony structure to find her gluteus tubercle. And to make sure I didn't go too lateral and I'm on her fibula, I will have her internally and externally rotate her ankle. And then if it is moving, so where my fingers are, I can feel it move, that would be where her fibula is, where my thumb is where the gluteus tubercle is.
short C. And now I'm gonna palpate the patellar tendon. So I'm gonna find her patella, which is this bony prominence right after her femur. And just below it, where you feel this connective tissue, you'll feel the patellar tendon. Okay, now I'm going to palpate the muscle belly of the semitendinosus. So I'm gonna have my patient lay prone. Okay, and to feel or to engage her semitendinosus muscle belly, I'll have her slightly flex her knee, and you'll feel the semitendinosus as well as the biceps femoris and the semimembranosus. You'll feel them harden. You'll go just a little less than medial, a little posterior to medial to feel the semitendinosus.
I will then show how to palpate your popliteal fossa. So I will have my patient lay prone. And first I'm gonna want to find the popliteus. So I will also have my patient slightly bend their knee, and it'll be the tendon that pops out. So I'll find that, and then she can relax, and I'll go just a little more medial, and it'll be like an indention in the back of your knee.
Okay, and now I'm gonna palpate the ischial tuberosity on myself. So I'll start by picking up my leg and placing it on the surface just a bit higher than my knees are. And then I'll feel right under my butt. And I'll feel this bony prominence, and that is your ischial tuberosity.
A patient, which I'll be performing as a patient and the tester. You would have your patient lay on sideline, having their top leg crossed over, and then again you would be feeling on their butt, finding where that bony prominence sticks out, and that would be your ischial tuberosity. So now I'll be doing the manual muscle test for the rectus femoris. So first I'll see if she can do the motion to see if she can have a 3. So just extend the knee, which is just straightening the leg. Great, we know she can do that, so she is now at a 3. I will then have one hand placed on her thigh, so around her rectus femoris, and just to stabilize that leg. And then my other hand down lower on the lower part, and I'm going to be applying resistance. First it'll be light resistance, and then more resistance. At first, if she can do it with light resistance, it'll be a 4, and then a 5 if she can do all of them. So you can go ahead and kick that leg out. Great, you're at a 4. I'm going to apply more resistance. And again, great, you're at a 5. So we know that she is at level 5.
So now I will be doing the manual muscle test for the 3 adductor muscles. So I'm going to have my patient lie sideline, and then I'm going to have her take her top leg. Since we are doing adduction, bringing the leg closer to the midline of the body, I'm going to have her take her top leg and cross it in front of her and make her feet flat on the table, like so. So then I'm going to see if she can do the adduction movement. She can, so we know she starts at a 3. I'm going to provide slight resistance around her calf area and a little on top of her adductor muscles where they would lie. I'm going to see if she can provide this resist my motion with my hand on her calf. And she does. So I'm going to move my hand a little farther down to the ankle and see if she can resist the motion here. And she does. So we know she is at a 5.
So now we're going to be strengthening and stretching the vastus medialis. So first we'll go ahead and stretch. So what she's going to do is, since this is a knee extension muscle, we're going to want to flex the knee. So she's going to take this right leg and try to grab her ankle, and that means we are now stretching out our vastus medialis. This is the leg, well, it's on the inside, the vastus medialis over there, yep. We would hold that for about 10 to 15 seconds, however long, do about 3 times, just get a nice stretch in it, so you can relax. So now we're gonna do a body weight and a resistance strengthening exercise for it. So first we'll have our feet spread about shoulder width apart, toes facing forward, and we're going to do a body squat. So, yep, there we go. And we're gonna wanna focus on our knees, not going too far over our toes, keeping it nice and in line. There we go, great. And next I'll have my patient short seat on the table, and I will grab a resistance band. And for this one, since we cannot wrap it around the table, you can do it where it is around both of your ankles. And then whichever one you are wanting to focus on strengthening, which we will stick with that right leg, we're going to keep our left leg more bent. That knee is going to be staying bent. And for our right leg, we're going to extend our knee out against that resistance. Yep, just like that. Try to keep our toes flexed, or our ankle flexed. There we go. And there we go. That would be first.
So now I'm going to instruct my patient on how to stretch her TFL or her tensor fasciae lata. I'm going to have her get on both knees, preferably next to something stable or wall. She's going to put her right foot on the ground and her left knee is going to be on the ground. She's then going to adduct her left knee, essentially trying to line it up with her right foot. She's then going to lean forward in order to target her lateral hip muscles in her left leg. She will hold this stretch for about 30 to 60 seconds. Okay, now we will strengthen her TFL muscles. So we'll first do without resistance. So she's going to slightly flex her hip, which will be taking a very small step forward, and she will then adduct her hip to target her TFL, since it is a hip flexor and abductor, abduct. So then we will provide resistance. We're going to take this light resistance band and put it around her ankles. She will then perform the same motion, slightly flexing her hip and then abducting it away from her midline.